Hi, I am Dr. Rukmani Chaudhary and in this video I'll be talking about DVT. DVT is deep venous thrombosis. So before discussing about DVT, I'll be talking about thrombosis. Like what is thrombosis? See, normally if there is a blood clot, means there is a stagnation of the blood and it is in the form of clot, then medically it is called thrombus and the process is called thrombosis. So if it is in the vein and that is deep seated, then it is called deep venous thrombosis, right? So this is how it develops. What are the causes, risk factors, and who are at the risk of deep venous thrombosis? This is a kind of again a blood clotting phenomena in which your blood clots, means there is a blockage, there is a interruption in the blood flow due to thrombus or thrombi we call it, and it hampers in the blood circulation. So there can be complication. We'll talk about any reason, any condition that hampers your blood circulation can lead to deep venous thrombosis. So the basic concept is the blood circulation issues, right? So one is aging. With age you develop there is a more chances of having blood clot. So yes, with age you can develop DVT, but irrespective of this, in our 30s you can develop this problem. It is like prolonged rest or immobility or inactivity. If you are on the rest, like you are on the bed rest, and that too for a longer period after any surgery, after an operation, yes, there is a lack of mobility, means you are not that much active, and yes, there is a poor blood flow, poor blood circulation, and that can lead to blood clot formation, thrombus formation. Inactivity again the kind of immobility. If you are not that much active, if your life is sedentary, you are not moving enough, you are not active enough, then again your blood is poor, the flow is poor, and yes, it can lead to clot formation, thrombus formation, and ultimately DVT problem. Pregnancy again a risk factors. Why? During pregnancy there is a high pelvic venous pressure, means your pelvic area pressure, and that can lead to blood clot formation. So pregnancy and overweight and obesity having the same factor, like in both the condition, if you are overweight, you are obese, then again you have high venous pressure, means there is a pressure is high, and that can lead formation, thrombus formation, and DVT. Birth control pills, they tend to blood to clot, so they increase your blood clot formation. So yes, oral contraceptive pills and birth control pills, they lead to clot formation. Smoking, one of the major risk factors. Smoking always interfere with your blood circulation. It increases the chances of clot formation. So we'll discuss in prevention part all these factors we will consider, and just have a watch on all these factors. Heart failure, you have your heart functions and your lung functions are affected, and they ultimately lead to clot formation, and you have thrombus, DVT. Bowel disease, there are certain disease like inflammatory bowel disease in which you have Crohn's disease and you have ulcerative colitis. They also lead to clot formation, thrombus. Family history and times, yet it runs in family, there are certain factors are missing, certain factors are the clot formation. So yes, these factors contribute to clot formation. Moving on, symptom part, what difficulty you have while you have these problems. At times it is asymptomatic, means you are having clot formation but you don't have symptom at all. But at times you have moderate symptom, mild symptom, and at times in some cases the alarming symptom. Alarming symptoms, in these cases you see your doctor right away. So we'll start with the moderate symptom, and then we discuss about the severe symptom. So moderate symptoms can be, if there is a clot formation, there can be redness, mild redness, and usually this thrombosis, usually the DVT, deep venous thrombosis, is found in your leg, lower extremities in your leg, but it can be in your arms and shoulder as well. So in your legs you have abnormal discoloration, and you have pain in that area, and you can have swelling on the affected area. So these symptoms can be there, and there is a slight warmth on that affected area you can have. So these are the symptoms over there. Once a condition is called pulmonary embolism. See, so the vein are the superficial blood vessels, and they carry blood from the organ to the heart for the blood purification, and the arteries are the blood vessels that carries blood from the heart to the particular organ, right? So if there is, due to any reason, due to any injury or any trauma, or after any surgery, if there is a damage to a vein, there is a blood clot formation, and then it is called thrombosis, and it can deposit it anywhere. Usually it is the main and in the lower extremity. So you have in your legs pulmonary embolism. There are the blood vessels that carries blood from that organ to the lungs, right? Like from the legs to the lungs. So if there is a clot formation, then the clot can go to that affected part, means can travel to the lungs, and this can cause breathing problem, breathing difficulties, like you can have shortness of breath, chest pain, giddiness, rapid pulse, rapid breathing. So these can lead to pulmonary embolism, and this part also of the DVT means this can lead to the pulmonary embolism, and it is a emergency critical condition. You see your doctor right away if you have these breathing related symptoms. So you see your doctor right. One more complication is thrombophlebitis. So these thrombus, these clots can damage your blood vessels, then these are called thrombophlebitis. Prevention or lifestyle modification, you are supposed to focus on your, just go through your causes and risk factors part and have a watch on all these causes and risk factors. Overweight, just try to control your weight, because obesity lead to the blood clot. And if you have smoking, if you are a smoker, so just try to quit, because smoking again lead to the blood clotting disorder. So this can tend to blood clot. So just avoid it and just have weight on your diet. And immobility is the most important factor. So just try to be active. If you are a driver, if due to any reason, if it is your job required field that you are sitting for a long time, you are standing for a long time, and you are you are not active, in a way that you are not active, you are mobile, you are not active. So just try to be active after every hour, so that your blood circulation is, you are in a motion and you are active, and your blood circulation is active. So there are less chances of having blood clot formation. So you can avoid it. You can accept is the basic thumb rule is that just be active, do exercises. Diagnosis part, what are the diagnostic criteria, what tests are required for diagnosing, for accessing the DVT. So the preferred diagnosis is duplex venous ultrasound. This is a kind of ultrasound that gives you idea of the blood flow, and if there is any interruption, any blood clot formation, it gives you the clear idea. And the next one is venography. The special dye is injected, and the X-ray is taken, and it gives you the clear picture of again the blood flow. If there is any blood clot, is there any interruption in the blood flow. Again, both these tests are the conclusion. They give you the idea. The MRI and MRV, magnetic resonance imaging and magnetic resonance venography, all these tests can be done, and CT scan again give you the all the structure of the organs or affected area. The treatment of DVT. See, there are several medicines in homeopathy. The concept is the holistic approach, means what symptom you are having as a whole. The concept is individualization, means what particular symptom you have, and the concept is which part of your body is affected, which side of your body is affected. And these are homeopathic medicines. You can find all medicines link on description box. If you are watching on YouTube, I have provided all medicines link on the description box. So we'll start with Apis mellifica. See, Apis mellifica is the medicine that is given in the swelling. You must have heard about swelling. So it reduces the swelling. It is given in the pain, in swelling, and lower leg pain you have, lower leg swelling you have. So this reduces your swelling, and there is a burning sensation, burning pain. So it reduces that. So you can have, this is the oral form of the medicine. Just have 1 or 2 drops, like twice or thrice before having meal. And all iodata. See, Calcarea iodata works wonder in thrombosis, clot formation, venous DVT cases. When you have the severe form, means you have ulceration, venous ulceration is there, then you can use Calcarea iodata. Again, 1 or 2 drops. You don't have to use all the medicines at a time. Just use all the medicine according to your symptom, what symptom you have. The next, Anica montana, pretty common in all clotting issues, like whether it is a heart clot or a brain clot. This medicine dissolves the blood clot and gives you a proper smooth blood flow, blood circulation. So this is very effective medicine when you have any clot formation, and DVT in DVT cases, and when you have bitten up feeling, bruised feeling, abnormal spots, we talked about that abnormal discoloration you have. So in that case, you can use Arnica. Very effective medicine, almost tops the chart. 1 or 2 drops twice or thrice before meal, and just use it regularly, like minimum 2 or 3 weeks, and it depends on the case history. How long is your case? How chronic is your case? So accordingly, you have to use the medicine. Bothrops. Bothrops is the medicine that is very effective when you are prolonged immobile, means after any surgery, particular after surgery, Bothrops is indicated. When you have surgery for any post-surgical cases, use Bothrops. Right-sided medicine you have, and there is a bleeding, there is a hemorrhage, so in that case you can use Bothrops. Again, oral form of the medicine, 1 or 2 drops twice or thrice. Cale, this is a different company. So see, medicine color, medicine the form of the medicine can be different, but you just always check the medicine's name. It should be complete. This is the main thing, and you can start even the lower doses, like this can be 6, 12 or 30, 200. It goes like this. So you can start with the minimum lower dose. So this is a Cale. In Cale you have cold feeling, numbness, icy coldness is there. So Cale is given, and you have the cramps feeling in the leg. So in that case you can use Cale. Again, this is a dropper form of the medicine, 1 or 2 drops directly on tongue before having your meal. This medicine is prepared from the snake, and the Vipera is given when you have long sitting. Your profile, you are obliged to sit for a longer time, and there is a hanging down of your leg, and just due to that you have the DVT. So in that case you can use Vipera. Vipera very effective medicine. You have busting feeling, so just use Vipera in that case. 1 or 2 drops twice or thrice. Hemamelis is given when you have Hemamelis is well known for the varicocele, for the varicose vein, for the improper blood circulation. So this gives you the smooth blood flow, and there is a busting feeling in the vein. So in that case you can use Hemamelis. Once again, 1 or 2 drops from the snake. Lachesis is given when you have a problem of left-sided, means you are having problem on your left leg, particularly in ankle. You have problem and ankle, there is a swelling, coloration you have. In spite of red, there is a dark bluish discoloration you have. In that case you can use Lachesis. Medicines can be given in the DVT cases. Rest depends on the complete case. So hopefully this video can help you. If you find this video knowledgeable and informative, please like, share. Don't forget to subscribe my channel and press the bell icon to get notified. Thank you for watching. Thank you so much.